Now, one of the students in our cohort actually has an earlier degree in architecture. And it occurred to me after my meeting with her on her, she's now going into a master's in composition. And she said, I don't know how to bring these two parts of my life together. And I was going to do binaural beats, but I'm thinking now to look at the acoustics of these spaces where patients are. The acoustics of where patients are, and maybe there's a way to make them feel better. Because these sound environments where patients are waiting in triage or in different spaces, it can be stressful, and I want to contribute to their well-being. And then I thought, well, there must be the field beyond psychoacoustics, which is a field that looks at the auditory apparatus, okay? There must be medical acoustics. And I look it up, and sure enough, and I look up here, Rochester, where, as I mentioned to you, I was teaching for some years, has a children's hospital called the Golisano Children's Hospital. Golisano is a wealthy family. Their name is on the hospital, having contributed so much. And this article you'll see in our Moodle is called A Sound Plan, How to Achieve Optimal Healthcare Acoustics. And what they're pointing to is that the sound environments in healthcare facilities is often not optimized for the actual context, the sociocultural context, the medical context, the pain context. Speaking personally, just before I turn to the article, I can tell you that in my conversation with this student, I was saying from personal experience, I remember maybe it was a few years ago, I had food poisoning. And so I was in the emergency ward, and I was there for 12 hours. I was there overnight. And there was no way, they didn't put me to a bed upstairs. They just kept me in the emergency in a bed. I was doubled over. But the trauma, the screams from other people in the emergency ward, in the emergency department, was very disturbing. I mean, this is not a calming environment. I thought, I'm a grown adult, whatever, I can handle this. It's distressing. But if I was a kid, kids come in also to the emergency department, and they have to listen to that also, these distressing sounds. And I don't know how to solve the problem, but I said to your fellow co-participant in this course, I said, I really wish that spaces were designed. I mean, here we are in the West, right? So-called first world country, but we haven't solved the acoustical problem of the stressful sounds of the environment because it's too far for doctors and nurses to walk. They want to keep track of everyone. It makes sense for everyone to be in the same space. I get that. But I wonder if in the future this problem of acoustics in space will be solved. And she said, well, I'm interested in rooms where music plays a contributing role, where it's the lighting, it's the softness, it's the decor, it's, everything about the architecture of the space contributes to the wellness of the patient, including the sound environment. And I thought, wow, that's brilliant, that's beautiful. Let's see if there's something called medical acoustics, and sure enough. So let me read to you from this article. As the lowest scoring category, the article goes, in the HCAHPS survey since 2007, quiet hospital environments are a challenging issue. Whether it's persistent alarms, buzzing equipment, traffic in the corridors, or staff conversations, excessive noise can negatively impact healing and a hospital's bottom line. Quote, considerable evidence has shown that pervasive noise raises, right? Psychological and physiological stress in patients, elevating blood pressure, heart rates, and perception of pain, says Tina Larson, principal at Corgan, Dallas. Reduction of noise can go a long way in reducing stress in patients and staff, improving patient satisfaction scores, and thus has the potential to improve reimbursement. So, to be honest, I'm not exactly sure what they mean by reimbursement here, but it might be a word with double meanings. Anyway, the article goes on to other things. Then another article from the Architect magazine, which is the Journal of the American Institute of Architects. And this is the title of this is The Art and Science of Healthcare Design. Again, we're dealing with acoustical spaces in the environments that you're working in. that you're going to be working in for what, 30, 40 years? So a critical awareness of the environments you're in and how they're affecting your social sense of centeredness, your sense of meaning, right? Because after a while, when you work a 12-hour shift and you come back day after day and you work double shifts, it becomes home in a way, right? This is a phenomenon that we have in modern society, that our work environments become a second home. Well, if your second home has an acoustical environment that could be more healthy, let's look at that. Let's look at something that's more pleasing. And what would that look like? What would that sound like? So here, the Art and Science of Healthcare Design, the subtitle of the article is Learn Where Designing for Healthcare Spaces is Headed and How Materials like Tile can help you set the stage for a beautiful design. And then I just love some of these sentences, so I'm going to read them to you because I think they might be personally meaningful for some of you. Here's one. Patient care drives healthcare design. Right? Sounds quite true. It informs every choice in the process. There are many different needs depending on the type of medical professional or specialty practice involved, but the objective remains the same, quote, facilitating patient safety and maximizing their quality of care is the goal for the architect, designer, contractor, and consultant. And this is spoken by a healthcare architectural designer. And they go on to say, patient care is complex. It must be medically top of the line, comforting in less than comfortable situations, and strategically designed to be emotionally supportive to patients and staff alike. And then it goes on to discuss what a healthy design would look like. So as these new spaces are being created, and maybe I suggested to this student, the fellow student, that she be one of the pioneers who create spaces. You know, even the testing sites for COVID, is there a way to architecturally design this so that acoustically it's comforting? Because as the test is going on, maybe there's a way to comfort people. I don't know. And the fact that I don't know means that it's not the norm to think like this, right? If you're an architect who's designing medical centers, yes, it's the norm. But for most of us, it's on the fringes of our awareness, right? We know it's uncomfortable. We know there's the machines and all this. And I'm reminded of the skit in The Meaning of Life. Do you know the Monty Python film, The Meaning of Life? There's a skit called, we need the machine that goes ping. You know, if you ever see this, maybe I'll put it below. Yes, the machine that goes ping. We don't know what it does, but it goes ping. All right. So, you know, acoustical medical environments have been made fun of, but it is more or less on the periphery of our awareness. And what I said at the top is, if you can be aware of how that aural, A-U-R-A-L, oral environment is affecting you, then please have some feeling of agency about it and use your own playlist. You know, create playlists for yourself that take care of you. Okay, and if you can create playlists of the ones you love, you know, for the ones you love, even with your voice like you did in week 5A, I think that was some of the reflections in the journals that were very beautiful. Because you were saying that, some of you were saying, like, for example, my sister said to me back that she preferred my voice with the musical backing, that I was calmer and I spoke slower, and she had preferred my voice with the music. And then I think your fellow student said something like, you know, something like lesson learned, or, you know, made a little joke. So we're busy learning all of this, aren't we? The last thing I was going to say here with regard to this, maybe let's leave it there for now.